Hello there and welcome to the presentation for the BSc Radiotherapy and Oncology course here at Sheffield Hallam University. So my name's Jo McNamara. I'm a senior lecturer here at Sheffield Hallam University and also the admissions tutor for the BSc Radiotherapy course and also the MSc pre-registration course Radiotherapy and Practice. So hopefully I feel that I'm suitably qualified to be able to talk to you today, largely because I am a SHU graduate. I studied at Sheffield Hallam University, I worked clinically at Leicester Royal Infirmary, and then I actually worked at the Weston Park Hospital here in Sheffield, and then came to work at Sheffield Hallam approximately 10 years ago now. Makes me feel quite old, and I absolutely love it. I'm still really privileged that I get to go into clinical, work alongside the therapy radiographers and support the students out in the radiotherapy department. One piece of advice I would give you is to join us on Twitter at SHU Radiotherapy. The reason being that we have a really good international radiotherapy community, and actually the Twitter account is involved in lots of engaging conversations around oncology and radiotherapy specifically, but it's also a great way to get to know our students and some of the things that we offer here at Sheffield Hallam that maybe you wouldn't find out about until you actually started the course. So just to give you an overview of the presentation I'm going to go through, I'm going to talk to you about life as a therapy radiographer, what it feels like to be able to be in that role, what's expected of you as a student, and also studying at Sheffield Hallam, what do we offer you, the experiences that we might give you, and also a little bit of information about employability. We also give you some information about what we're looking for. So when you're going through the application process, it hopefully helps you to write personal statements to support your application and also get an understanding of what it is that we want you to talk about within your interview. There is a lot of information on the Sheffield Hallam University website, so please do take the time to go on there and have a look and make sure that you're familiar with maybe some of the key themes that we might potentially ask you about. So unfortunately, cancer is very prolific worldwide, and every 2 minutes in the UK, someone is diagnosed with cancer. Approximately 1 in 2 people go on to develop cancer at some point in their lifetime, and therefore it's no surprise that there is a lot of emphasis on the oncology provision that we provide here in the UK. 42% of cancers are preventable, which is quite a shocking statistic, and it's definitely what we're starting to consider as allied healthcare professionals around how we support and educate patients and service users, specifically around their lifestyles and their health, and looking in terms of survivorship. So more people are surviving cancer now, so we need to make sure that we're educating them to make adaptations to their lifestyles so they don't go on to develop cancer again for a second time later on in their lives. So radiotherapy treatment itself is the treatment of cancer using high ionising radiation delivered via linear accelerators within specific radiotherapy departments. It is a very specific type of treatment and can only be delivered by therapy radiographers here in the UK. Over 50% of all cancer patients will have radiotherapy at some point during their cancer pathway in the UK, and it's not surprising that with advances in technology and software, that may be even increase further in years to come. A lot of our patients will have quite a complex individual pathway. Some patients might have surgery, chemotherapy, and then some radiotherapy at the end of their treatment pathway, whereas others might come straight away for radiotherapy and then with an aim to actually shrink the tumour to then go on to have surgery afterwards. So every patient is individual, and we look at their individual cancers and their overall treatment diagnosis to be able to actually plan their treatment sufficiently. So life as a therapy radiographer. Obviously, I am very biased. I absolutely am passionate about being a therapy radiographer. It is an amazing job, highly rewarding and very dynamic. You know, no day is really the same. Every patient is different. We have different problems to solve on a daily basis. And it's kind of that really drew me to radiotherapy. You get to build a really good rapport with your patients because you get to see patients when maybe they're quite vulnerable in their lives, and actually you can provide them with the care and support they need when they're going through a very difficult time in their life. You also have the technological side of the role. So we use very expensive equipment. We have to ensure the accuracy and reproducibility of the treatment that we're delivering. So that does require high levels of responsibility and also accountability. Now, some people may actually feel that working with cancer patients is quite a depressing job, when actually I can definitely say that when you go into a radiotherapy department, it's actually a really pleasant place to be. There's a lot of positivity. The fact that a lot of our patients are going on to be cured as a result of having the treatment is obviously meaning that it isn't necessarily a depressing place to work. And I know from experience, when you talk to people about working with cancer patients, they automatically go, oh gosh, how do you do that? It must be really difficult. And don't get me wrong, you will always come across cases or situations within your working day which might pull on the heartstrings. You might meet people that maybe have a cancer diagnosis similar to someone in your family, and that can actually create an emotive response to that. We kind of want that because we don't want you to be hardened to your emotions, but we need to make sure that all of our students have considered how they might deal with those kinds of situations. Would you be able to cope with someone who is very poorly, who is coming to the end of their life, and maybe attending radiotherapy for palliative reasons? So I briefly mentioned palliative radiotherapy there. So when patients come into radiotherapy, we usually categorise them as palliative or radical. So radical is there for the aim to cure the patient, and many of our patients who come for radiotherapy are classed as radical. But we do have patients who are palliative. So as you can see from the scan on the right hand side of the page, we do have someone here who has a mesothelioma tumour. Now, this chap actually was a plumber. He, at the age of about 14, started working with his dad, and at some point in his life, he actually had exposure to asbestos, which is typically associated with mesothelioma tumours. So he went to his doctors with some symptoms and then went on to have diagnostic tests which confirmed that he did indeed have mesothelioma. As part of his treatment pathway, he did come for radiotherapy, and as you can see, we targeted very specifically just the tumour itself, delivered the radiotherapy, and then the lower scan that you can see is 10 weeks after the treatment. So we haven't got rid of the cancer, but we have actually reduced it to such an extent that any symptoms that he may have had have actually disappeared. So if he was coughing up of blood, or if he was experiencing some dizziness, breathlessness, all of those things commonly associated with lung cancer hopefully would have diminished to such an extent that the quality of life is improved. Now, the radiotherapy process itself is quite complex. You have lots of different components, and patients will go their own individual pathway through the radiotherapy department, depending on their type of cancer, where it's located, the different treatment modalities that they may have already experienced. As a therapy radiographer, you do get to experience all of these different diversity of role, and actually we have planning, dosimetry, and we also have diagnostic tests that we utilise within the radiotherapy department to actually check the localisation and verification that we're treating in the right place on a daily basis. There are also different types of radiotherapy. So there's the external beam treatment delivered using the linear accelerator, and we also have brachytherapy treatments, which is the use of radiation sources within the patient itself, so maybe for a cervical cancer. Now, as you can see from these pictures here, this is just to show you some of the radiotherapy equipment. Hugely expensive, we're talking about millions of pounds worth of equipment, but that just goes on to show you how we need to ensure that before you go out into the clinical setting, that we've adequately prepared you for practice. We don't want you to go out into the radiotherapy department concentrating on using the equipment and forgetting that you actually have a patient who you need to look after. So why Sheffield Hallam University? I do appreciate I'm slightly biased, but we are the largest UK provider of radiotherapy education here in the UK. We have 55 BSc places and we have 15 MSc pre-registration places. We have outstanding facilities. We have a full virtual learning environment, which we call VIRT, and we utilise this quite extensively across the course to look at 3D anatomy and also some of dosimetry and planning. We also have a world-renowned Eclipse planning suite, which I think actually quite a few of our clinical partners are quite jealous of. We have a lot of computers with very expensive, sophisticated software on, which allows our students to be at the forefront of developments in radiotherapy planning. We also have simulation sessions where we utilise some of the clinical lasers, which actually help set patients up. And as you can appreciate, preparing you for going into clinical is a real advantage. We want to make sure that you feel confident with what you're doing, but also that you can go in kind of knowing what it is that's expected of you as a student. We also engage quite heavily with service users. So rather than me telling you what it's like to be a cancer patient, actually we have a cancer patient talking to you about what's important to them. You know, what should you be doing to support them through their actual cancer journey. We also achieved 95% NSS satisfaction over the last 2 years, which is absolutely fantastic. And actually what some of our students say on a later slide kind of indicate how students love being at Sheffield Hallam and the support that they receive during their training here. We do also provide interprofessional learning. So at some points through the course, you will get the opportunity to align your learning alongside lots of different disciplines. So diagnostic radiographers, midwives, nurses, we also have OTs, physios, paramedics, and that's a real opportunity for you to engage with healthcare, look at some of the policies, and also get an opportunity to learn with, from and about other disciplines. 2 of our students have also won the prestigious Student of the Year award for the last 2 years in a row, and that is a huge achievement, and also demonstrates some of the opportunities that we provide our students as extracurricular activities, as well as the standard course. So we do have a SHU learning philosophy, and I won't go into too much detail about this, but our aspiration is to equip everyone with the knowledge, skills and values that enhance your employment opportunities. We really do try and instill a strong professional identity, as well as the confidence in working within your own discipline, but within a multi-agency environment. So these are just some of the things that our students have said. So the course is demanding but really interesting. The course is really interesting and delivered well with lots of revision sessions and support. I would say I asked these students for these quotes after their first semester. Now, the first semester is really hard. It's not like maybe other courses where you might have one day in university and then the next day off. Actually, typically, for this course specifically, you're in Monday, Tuesday, Wednesday, Thursday and Friday with the weekends off. And that's definitely something to consider in terms of how demanding the course is. So it is a 3-year course. We're really lucky here at Sheffield Hallam to have a large radiotherapy team. We have lots of people that feed into your education, from those who have just left clinical practice to those who've been in academia for a long period of time but have extensive knowledge in research. So all of this hopefully supports you in your education and basically gives you the best quality of education to be able to deliver the radiotherapy practice that we hope will go on to transform and also develop radiotherapy services. You'll also see there that we've got innovative assessment methods. So we don't rely on just assignments. We give you lots of different ranges of assessments, and that really plays to different strengths then and learning styles. Now at Sheffield Hallam University, we have a very large cohort each year, and as a result of that, we need to make sure that you have adequate clinical placement to be able to develop your skills. Now, unfortunately, even though in Sheffield we have Weston Park, we can't put all 55 of our students each year into that department. There just isn't enough opportunities for you all to learn and experience using the equipment. So we have 9 clinical partners, and they range for as far down south as